Daily Lunch Dojo here. We got me, Jacob Crowder, here by myself, and go over a really important topic here. As a reminder, we are doing these for the first 20, 30 minutes of the hour. The rest of the hour is going to be with our career guru agents through our Zoom meeting here. So this is going to be the topic to kind of set the baseline for what that discussion is going to be. But going back with Stephen here, where Stephen, you'll see him, all you guru agents here, about 12:30 or so for the Zoom call. But me and him were kind of kicking it back and forth, and he wanted to go over something that was very vague that made me laugh. But then finally, we kind of got to a point here. He wanted to go over what we call in the sales process discovery here. Okay. Now, this is important for any new agent, any old agent, any agent that only does one product that now might have a different line of products that they can do, such as if you're strictly a supplemental and now you do your AHIP, you have Medicare Advantage, versus if you're just Medicare Advantage and now you're adding in some supplements and you don't really know how to dip your toe in that water or what to do. What we're going to go over and setting here as a baseline is everything that you need to know about the discovery, but more importantly, where it leads you to. And it's an old cliche statement, but it really does work when you think about the fact that these clients that you're helping, these people that you're interacting with, this is not an acquisition role to where it is a one and done. It is not a one conversation. I'm never going to see you again. Give me your MBI and let's roll. And then you disappear. No, this is a lifelong commitment that you're making to these people. You're going to say, look, I'm going to be your person. I'm going to be the person here to help you whenever you have questions. So what me and Stephen agreed to go over today is really needs versus wants when you're doing your discovery. Okay, for me, I always like to click with the person first and foremost. Especially during discovery. If they're kind of quiet, guess what? I'm going to come out swinging. Where if I tell them, hey, hey, it's Jacob Crowder here. How you doing? They go, oh, I'm fine. I'll go either, oh yeah, well, what's going on? Or if I go, yeah, they go, yeah, I'm doing good. How are you doing? I go, well, let me tell you, I got a new Peloton bike here, and it's really hurting my butt with the new seat here. I'm not used to it yet, so that's kind of the hurdle I'm coming over here today. Go into something like that to where it's not just good. Okay, perfect. So the reason for my call is people get these calls all the time. They want to work with somebody who's personable, especially because by the end of it, they're creating a relationship with you. It's going to be you and them together, as we talked about yesterday, on a peer-to-peer level. So you want to have as much conversation and do as much discovery when you're having that conversation with these people. Because not only will what you find out, it's going to affect everything. So to start off, really, some of their personal history, if you can get into that, it is really good to know. A simple question that I started incorporating here with what I do is, who comes and checks in on you? There's a lot of people we work with, that are of the senior age. They don't have a lot of people close by majority of the time. If they do have a family member, it might be down the street. It might be the next town over. It might be the next state over. But there's a reason that we ask that question is because you genuinely want to know, okay, who checks in on you? Do you have anybody that comes in if you were to have a fall? If you fell down your stairs, if you fell in the shower, who's going to be there to help you? Does that person even really know? It's really good to kind of set that groundwork there and get all those answers, because guess what? When you're doing the discovery and you're finding that out, when you are leading to a final expense plan, right? What does every final expense have to have? A beneficiary. Okay, who are you going to recommend for the beneficiary? The person that checks in on them. Same thing with a cancer, heart attack plan, any type of illness, accidental plan. You need a beneficiary. You might as well find out, because guess what? It's a whole lot easier to loop it in when you break everything down and say, look, now let's take my sister, Sarah. Now you can say, look, now for this policy here, we're going to make Sarah the beneficiary, so that way she gets the money if XYZ happens. Now, first and foremost, would I allow Sarah to do that? Heck no. I didn't put my sister on there. But it's a whole lot easier to approach that and paint that vividly in their head instead of saying, okay, the way this cancer plan works, it's a first-time diagnosis. It's a $20,000 payout, and that $20,000 check can either go to you or it can go to a beneficiary of your choosing. Same with your final expense. Your final expense, it pays out a flat check after you present the death certificate to the company. They write the check to you in the mail. It can go to your estate or it can go to a beneficiary, whoever you want. At that point there, you don't have the answers to fill in those gaps, but I can say, look, if you get diagnosed with cancer, your sister Sarah is going to get $20,000. Or if you pass away, once Sarah gets the birth certificate, she's going to get a check for $15,000 to help with your final expenses. That's a whole lot different type of way to approach this. And it makes it a heck of a lot easier if you just are willing to dig in more. And that leads me to the next thing here, which is needs versus wants. Okay. Now, a lot of us, when we get stuck in a rut, and it just could be a personal one, it just could be what you're safe with, it could be just maybe the only product you're contracted with. Okay. Say right now you're only contracted with Advantage plans. All right. What are you going to do when you talk to somebody that wants to enroll in a Medicare health plan? You're going to advise them to get an Advantage plan because that's the only thing you have available. There's no other option for you to do. There's nothing else for you to look into. So guess what? You are going to hype that Advantage plan up as much as possible. But let's say this person lives in rural Montana where the nearest doctor, there's only one in town, but the specialists are 200-300 miles away, and they've got every ailment from A to Z here, and the minimum out of pocket is $9,000 in the area. Well, guess what? That Advantage plan and all you're hyping up to be, that's not what the client needs. That's what you want to sell them. So keep that in mind here. It's not what you want to sell them, it's what they need. That way, when we do conversations here, when I teach my people on what to do, when you're doing the discovery, there is no path that you take until you get to a certain point. Okay. When you start off, you're finding out about their zip code. You're finding out what type of current coverage do you have? Do you have employer coverage? Do you have any type of Medicare plan here that is active? From there, you go into the ancillary products. Do you have final expense? Do you have cancer plan, hospital indemnity, dental plan, drug plan? What medications are you taking? What doctors are you going to see? Everything like that. There is not a set direction on where we're going with this conversation yet. Because in my head here, this is how I operate. So you guys know me primarily, I am a supplemental agent for very many different reasons. But the few that I say are, number one, because I know how a Plan G works. I know I'm not going to get calls to call carriers about bills. So that's going to free me up to sell more in the long run if I don't have to service the policy as much. Number two, I know it's an upfront commission with a higher renewal. And guess what? The only way that they can switch policies is to be underwritten. So they have to be healthy enough to do it. If not, I'm still getting paid on that renewal. There's not some dumb SEP every 3 weeks where these people can enroll in. Okay. You're keeping that business. That's why I like the supplementals more. But take me here. If I have somebody who is borderline, let's say they're in Florida, all right, and they live directly across from the hospital that has every single specialist known to man. And if you guys know supplements, you guys know Florida is one of the most expensive areas, okay? And we'll say this person's 70, right? 70-year-old male, you're getting a Plan G. It's probably going to be about $270 or so. Just ballpark off my head here. It's going to be well over $220, okay? If there's an Advantage plan that has all his doctors in network, all his prescriptions are covered, and his MOOP, his max out of pocket, is $900, even though I want him to have a supplemental plan because it makes his life easier. He doesn't worry about claims. It makes my life easier too because it's very easy to service. That's not what he needs. That's what I want to sell him because it's easier for everybody. But it's not going to help him. It's not going to fulfill the needs that he has. So what we do here is when you're doing your discovery and the information that's coming along, really, you want to be as vague as possible until you get up to the point that we bring up for selector questions. Now, selector questions, everybody kind of has their own. Everybody has their own little flair to them, but they all come down to the same thing, where you are adversely stating this is what a supplement does, this is what an advantage does. Which one would you like? Okay. Let's take, for example, okay, do you want to use a network to where you have to find your providers, everybody has to be a network, or would you like to not have a network and use Medicare as a primary insurance? Okay, that's one. Another one here too is, are you okay with a lesser premium monthly, but a higher out of pocket versus a higher premium monthly and no out of pocket? Comparing the premiums. I can keep go on and on with these here, but after 3 or 4 of these questions, really comparing advantage to supplement, you're going to go, okay, it sounds like you need an advantage plan, or it sounds like you need a supplemental plan. You get somebody, like I said too, that has every ailment known to man, diabetes, cancer, they're in dialysis right now. That advantage plan is not going to help them, because they are going to be nickel and dime to death. I tell a lot of people that I work with here, especially ones that have supplemental plans, and they go, well, I see the commercial for I can get dental and vision and hearing, and they'll throw me some extra money. And I go, okay, let me explain it like this here. Advantage plans are for very healthy people. That's the breakdown of it. Now, why is that? Because you pay as you go. It's a $0 premium, right? So if you're healthy and you go to the doctor once a year, guess what? You're making it out ahead. But supplements are made for people that are not healthy, because the way that they operate, you're not going to be nickel and dimed. You're not going to reach your out-of-pocket maximum. That it's going to be, $5,000, $6,000, $7,000, depending on where you live. I remember there was a Cigna in Florida that was $13,000 for out-of-network. It can really get up there. And I had that's right, Buckley. And I had a husband and a wife, both had to have multiple surgeries that year. So they each paid out $26,000, or total $26,000 together.
And those are stories you can tell people.
Yeah, exactly. This is what you need to be telling people when you're, going over the difference here. But back to it here, the supplements are made for sick people, because guess what? You're paying a set monthly premium, and we'll take a plan F here, $0 across the board. You don't owe anything. All you have to pay for is $200 a month, and all your hospital is taken care of, and all of your Part B outpatient is taken care of. Okay? I've had people break down on the phone when they're turning 65, and they've got, they're on their wife's. I remember there was one guy I worked with here in Texas where he was on his wife's insurance, and he could barely even walk. And he wanted so bad to go to physical therapy because he wanted to walk to his mother's gravesite, and he hasn't been able to walk for 3 years. And I tell you what, when we wrapped up his Plan G application to start for the next month, he started crying. And I was just telling him, but hey, it's going to be okay. We got everything set. And he goes, no, you don't understand. My wife's paying $900 a month to have me on her insurance right now. And every time I go, it's expensive, and I can't afford physical therapy. I can't go as much as I need to get my mobility back. But now with this Plan G, I just have my premium and my one-time deductible, and it's the very first month, $300 with the deductible. This is amazing. Okay. You have to have those stories in your repertoire to really discover what is the best need for the client versus what you want to sell them. And the best way to do that are the selector questions. You really got to figure out what is best, because guess what happens? If you sell them something that you want to sell them that they don't need, we'll say an advantage plan here, okay? You'll say you sold them one during AEP. All right, started January 1st. Guess what happens January 1st? Every other agent in the country is calling them because they can change. And what are those agents saying? I can get you more benefits. I can get you more money. I can get you everything. But what does it fall back on? There's no difference to what was available October 15th of 2022 that's available January 1st of 2023. So when you're doing your discovery, you have to make these important, really, findings in how a person operates and what they want and what they need at the same time. and fulfill both of them. Because if you don't, I'll call them and I'll sell them January 1st. And guess what? If you got forwarded any money, you owe it back to the carrier. Because I'll tell you this, every client that I have is a Jacob Crotty client. And they call me before they call anybody else. They don't call the advertisements. They don't do anything like that. Why? Because I put in the 2 to 3 hours in the very first call to stake my claim, to put my flag in the ground and say, look, this is Crotty territory. Ain't nobody else coming around here and is going to touch your Medicare or help you out. I'm your guy. Now, I know that's hard for some people to understand. Why the hell would you spend 3 hours with somebody on the phone? Why? Well, remember here, I want to help them. Number one, you have to genuinely want to help people. Okay? That's my want. My want is to help people. I don't want to have to sell you something. You can go out there, you can pull call records. I say that repeatedly to people. When they're like, this is a sales call, I say, I don't want it to be a sales call. You know, not only does it keep them off track, what do you mean you don't want it to be a sales call? I don't want to have to sell you something. I want to make sure that you know what you have and you're in the best possible situation, okay? I don't want to sell you something because you should already be in there. Now, if you need my help to get to that best possible situation, then I will help you. But I don't want to because you should already be there. All right, that is exactly how you have to approach it. So when we go back to, if you just have these single lines that you're focusing on, if you're just an MA agent, if you like MAs because that's the most possibility, you don't have any underwriting, you don't have to do research on which prescriptions are declinable, how different conditions are underwritten. I get it. It's okay. Everybody's got their thing. I love underwriting. And I love being declined because then I go, okay, where did I mess up? Where did I go wrong? I got to learn something here. Everybody's a little bit different. But if you are strictly Medicare Advantage, you need to broaden your horizon just a little bit and do have some of these in your repertoire. Because just like what I said about the example I had with a guy here in Texas, okay, if he went to $0, sure, that would save him $900 a month coming off his wife's coverage. That man has to go to physical therapy every other day in order for him to walk. And he can't even walk yet. He has to relearn everything. You think he's really going to like having a copay for that? God forbid it be out of network. And now it's not a dollar amount, it's a percentage amount. That's not what he needs. Now, you may want to because guess what? You got a lot of ailments. I don't have to underwrite you. All I need is a SCP. I just need a button out of these 15 that I can click on and I can get paid down the road. It's got to be, if you want to be successful, if you want to continue in this business and be known as somebody who doesn't have to pick the phone up to get business. That's where we all want to get to. That's where I want to get to here in 2 years. Where I don't have to pick the phone up because I get so many referrals, I get so much new business sent my way, I just got to pick it up. And whether that's a rewrite, whether that's a new business, whether that's adding on business, or it's a referral, everybody wants to get to that point. But in order to get there, you have to start caring from day one and helping people with what they need, not what you want to sell them. And the last thing here before we go over to our Guru Career Agents, just want to get a little reminder here about the MA open enrollment period that's coming up. Okay. I remember with a lot of these people, you can switch them. You certainly can. You can take them off original Medicare. You can get them to a supplement. There are a lot of possibilities here. But what I want to challenge you to do is not only to find out what these people need, but spend time with them. Because these poor people, especially the ones that are on Medicaid, the ones that are DSNP eligible, those get flipped like pancakes. They really do. If you can get a DSNP to commit to you first, they have to buy you first. That's the whole thing of this, especially talking about Advantage plans, and so many times they are able to switch. If you sell an Advantage plan, you better make sure that they know your name, your phone number, your email, maybe the last 4 of your social, your dog's name, your favorite color. They got to know all that. I had a lady one time, sorry to break here, Buckley. I had a lady one time, I sold her Cigna Advantage plan, okay? And me and her were just chatting, sweet lady out of South Georgia. And I asked her, or she asked me, what are you making for dinner? And I goes, oh, I'm making pork chops, shake and bake pork chops in the oven. Okay, well, she called back and she goes, I want to talk to Jacob. And he goes, I think he's the one making pork chops tonight. And then Andrew, who answered our phones, he goes, oh yeah, I'm making pork chops too. And she goes, do all you Texas boys just eat pork chops? And she goes, well, a few days a week. I'm like, okay. Guess what that lady did the next 5 times she called in? She called in and goes, hey, send me the pork chop. And I loved it. All right. I loved it. If I only had one interaction with her and we weren't able to have that conversation, if I had somebody shooing me to get off the phone or say, you're spending too much time with this person, you need to go on to the next sale, she still wouldn't be on my book of business. Because again, everybody is ruthless when it comes to special enrollment periods. Now, you really luck out if there's only 5 or 6 plans in the area. But once you start to get to the more populous areas and there's 30, 40, 50, 60, it's a bloodbath and it's last signature wins and everybody wants a piece of it. So in order to distinguish yourself, to keep your clients that you work hard for, there's nothing more than you should hate than a decline notice or a cancellation. Those should absolutely piss you off. And the minute you see that email, you should be on the phone talking to somebody, talking to that person, figure out what is going on. Because those are 2 things that should never happen. They only happen if you are helping them get another plan and then you help them cancel that plan too. Okay. So, reminder, help people with what they need, not what they want. Can't tell you how many people call in and say, I want a food card. And I say, okay, is it better to have $25 worth of groceries or lower your out-of-pocket by $4,000? And a lot of times the out-of-pocket wins. Help them with what they need, not with what they want. All right, that'll do it for me here, guys. We are going to hop over to the Zoom meeting. Steven's going to pop in here too. So we will be all set up. He's going to go over some of the things that I chatted about. Again, if you're not a part of Guru Career, hey, go to MedicareGurus.com or give us a call here. That is exactly what we're for. It's like modern age FUBU. It's for agents, by agents. We're here to help you out. So if you want to know about it, just give us a shout. I meant to rhyme that too, Buckley. That's really good. So that is it for me. Wrapping up here. Thanks again, guys, for watching. It's Jacob Karate. And now that we're on the Peloton grind, I learned a new saying here. This is what the instructor says. He says, be good. And if you can't be good, be safe. Thanks, guys.